Hello, friends. You're welcome to our session today on phonetics and phonology with Carol. In today's class, we'll be looking at the mechanics of speech production. What are the phases or the stages in the process of speech production? We'll be talking about 4 different processes: the airstream process, the phonation process, the oro-nasal process, and the articulation process. If you want to know about this, please stay with us on today's topic. We'll begin with the very first of the processes. We'll talk about the airstream process, and then we move on to the phonatory process, the oro-nasal process, and then the articulatory process. The airstream process. Do you ever wonder how you get to produce speech? Or do you just assume that because you can just open your mouth and say whatever you want to say? It's not that easy because speech production is a relatively complex process. And so the air that you breathe in is a very important aspect of speech production. Yes, without air, there can't be speech. And we're not talking about air just there in the atmosphere. We're talking about air which is drawn into the body, housed in a chamber, and released at the right process. So air and the chamber which holds it, really the chest cavity, are very essential to the process of speech production. And because we're talking about human speech sound, we're talking about the airstream from the lungs, technically known as the pulmonic airstream. That is the most significant airstream for speech production. Of course, we know that it is the respiratory system that is responsible for the breathing in and breathing out of air. Now, it is the same air that you breathe in and breathe out that we use for speech production. The air you breathe in is known as the ingressive airstream, and the one you breathe out is the egressive airstream. And because when you speak, you release air to the atmosphere, it is actually the egressive airstream that is used for speech production. And if you now relate it to the source, which is the lungs, then it is the pulmonic egressive airstream that we use for speech production. This air is housed in the chest cavity where the intercostal muscles of the walls of the lung act as an initiator. What do these muscles do? They contract to release the air to the atmosphere, and they expand to draw in, to fill up once again and pull in air. And this is a continuous process, okay? So with the chest cavity acting as the chamber, the intercostal muscles act as the initiator. And so air is drawn in, released, inhaled, exhaled, depending on the particular term you want to use, giving us the distinction between the ingressive and egressive airstream. And of course, we've said that it is the pulmonic egressive airstream that is the most significant airstream for speech production. Now, this doesn't mean that it is only the pulmonic airstream that is possible, but that is the most significant. So we'll talk about some other airstreams. We have the glottalic airstream that is generated in the glottis. The glottis is that space, that opening between the vocal folds in the larynx. And this is the airstream that is responsible for the production of the glottal stop, some ejectives and implosives. You produce them using the glottal airstream. We also have the velaric airstream. It is generated between the velum and the back of the tongue, and that is the airstream that is used for the production of clicks. So long for airstreams. Let's move on to the second process, which is the phonatory process. As the air leaves the airstream, as the air leaves the lungs, it moves upwards in the human anatomy. And the next point of call is the larynx. The larynx contains the vocal folds, and between the two vocal folds, we have the opening or aperture, if you like, which we call the glottis. So phonation refers to the state of the glottis. And what do we mean by the state of the glottis? These vocal folds are capable of closing and opening. When they close, they make it difficult for the airstream from the lungs to pass. And when they are open, the airstream can move freely. And this gives us the distinction between the voiced phonation and the voiceless phonation. And this is how it happens. In voiced phonation, the airstream has to pass through a relatively closed glottis. So there has to be pressure. The pressure with which the airstream forces its way through the vocal folds, through the glottis, forces the vocal folds to vibrate. And the vibration that results is what we feel as voicing. So glottal closure gives us voiced phonation. On the other hand, when the vocal folds are held apart and the airstream from the lungs flows freely out upwards, there's no pressure, there's no vibration. What is produced is a voiceless sound. So that is the situation of voiceless phonation. These are the two basic phonation patterns, the voiced and voiceless. We have others like the whisper or murmur, the breathy, the creaky phonation. Like whispers are produced when the glottis is left open throughout the speech, in which case there is no distinction between voiced and voiceless sound. That is when you have the whisper or murmur phonation. But basically what distinguishes speech sounds is the voiced phonation and then the voiceless phonation. We'll move to the oro-nasal process, which is the third. If you're following, you will see that we are moving from the air stream that has left the lungs to the larynx. And above the larynx, this airstream has two escape routes. It has two escape routes. One is the oral cavity, the other is the nasal cavity. Oro-nasal is a blend of oral and nasal. So this is the stage at which the speaker has to determine whether the sound to be produced is an oral sound or a nasal sound. And there is a particular organ that is responsible for this, the velum. When the velum is raised, it blocks the air from passing through the nasal cavity, and that gives us oral sounds. So we see that vellic raising or closure results in the production of oral sounds. On the other hand, when the velum is lowered, it blocks the air from entering into the oral cavity, and it gives us nasal sounds. So again, the vellic lowering or opening results in nasal sounds. There are also cases where the velum is neither raised nor lowered. In that case, it maintains a neutral state. That case, you have the air flowing simultaneously through the oral cavity and the nasal cavity, and that results in nasalization. Okay, so the process, the oronasal process, is basically the function of the velum, or soft palate, if you like, that flexible tissue at the back of the hard palate towards the back of the tongue. And if you look at this diagram, you'll see the oral cavity painted in yellow, and then the nasal cavity painted in pink. Look at the back, you see the velum suspended between the two. So it is the position of the velum that will determine whether that air coming from the larynx passes through the nasal cavity or the oral cavity. So the velum is a very important organ in the process of speech production. Then we move to the next and the last of the processes, which is the articulatory process. The articulatory process is simply that point where the organs of speech, the articulators now, in the mouth, come together, come into contact, assume different positions to modify the airstream from the lungs so as to produce the sound that they are designed to produce at each point. So we have two main types of articulators, the passive and the active articulators. The passive articulators are those which do not change their state, do not change their shape, they do not move, they remain fixed. The active articulators are those that are capable of moving to initiate contact with other articulators in the course of speech production. For the passive articulators, we have organs like the teeth. Your teeth can't move. The alveolar ridge, the palate. And for active articulators, we have the tongue. The tongue is actually the most mobile of all articulators. And then the velum, we have already explained how it is raised or lowered to determine the oronasal process. And of course, the lips, you can see mine moving. The lips are active in the course of speech production. During the articulatory process, the points at which these organs come in contact determines the place of articulation of consonants. So for instance, if it is two lips that are involved, like I have b, b, then we'll be talking about a bilabial sound. Sounds, consonants in particular, are named based on the point of contact. That's their place of articulation. And the nature of contact is what determines the manner of articulation. So before we enter this class, we're going to have a recap, but we'll first look at these places of articulations I will talk about. Look at the nasal tract, look at the alveolar ridge, the dental sounds produced in the teeth, bilabial sounds produced with the lips, palatal sounds produced with the tongue and the palate, the velar sounds produced in the velum, and then glottal sound in the glottis. I'll recap now. We were able to discuss 4 processes in the speech production process. The airstream process, which generates the airstream for speech production, primarily the pulmonic egressive airstream. Then we talked about the phonatory process, which is based on the state of the glottis, basically producing voiced and voiceless sounds. Talked about the oro-nasal process, in which the velum determines the production of oral and nasal sounds. and the articulatory process, where the articulators assume different shapes and come in contact, modifying the airstream from the lungs to produce speech sounds. That's the end of our class for today. I hope you enjoyed it. I hope you have learned one or two things. Please join us again on phonetics and phonology with Carol. Bye.